day, everyone. Welcome back to another episode of Black Health, brought to you by the Health Foundation of South Florida. I am your host, Dr. Michelle Kirwan Bythewood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami Gardens, Florida. December is Seasonal Depressive Month. As we enter the holiday season, many people are affected by the holiday blues. Many people feel they get the winter blues. Today, we are actually talking about SAD, Seasonal Affective Disorder. Dr. Delvena Thomas is here to help us unpack the differences between these terms. Dr. Delvena, welcome back to Black Health.
Hey, how are you?
I'm doing well. Give me a moment to introduce you. Thank you for coming back. Dr. Delvena Thomas is a board-certified psychiatrist, mother, soldier, scientist, and advocate. She trained in medicine and psychiatry at the University of Maryland, Baltimore. She is board-certified in psychiatry and neurology, has a private practice in psychotherapy, psychopharmacology, and alternative health. She's the author and producer of her own podcast, the Brain Love Podcast. You can find her latest mental health books on Amazon, Brain Sleep and Brain Food, and she is the co-host of MIA Media Group's show, Soul. And I always say you're a busy lady, Dr. Delvena. Thank you for coming back on Black Health. So today we're talking about SAD, Seasonal Affective Disorder. Can you start by explaining what that is?
Well, seasonal affective disorder, Michelle, is a fancy type of major depression, basically. Seasonal affective disorder presents in ways that are very similar to major depressive disorder, except that these symptoms present during a very specific time of the year. So typically, we start seeing people experiencing symptoms in the fall, and these symptoms go into the winter months. Global statistics show us that the month of December has the most reports of depression and depressive symptoms. And, pardon me, in addition to that, December is the month where we see the lowest availability of mental health professionals because of all of the holidays, the Jewish holidays, Christmas, and everything else.
Yeah, that makes sense.
Yep.
Yeah. So what is the difference between, or are they the same thing? The holiday blues. People say I get the holiday blues. That's typically December and maybe late November. People say I get the winter blues. And then we have seasonal affective disorder. Can you tell us what the differences are? Are they all the same thing? Are they different things?
Yeah, they are absolutely not the same thing. You and I are physicians, we're clinicians, and so we know that diagnosing and, as people call it, labeling is very it's essential. It's necessary. We have to do this in our practices. And so the difference between those three terms. The first thing is that it's coded differently. The second thing is that it's coded differently because seasonal affective disorder is an actual disorder. Whereas the holiday blues and the winter blues, those are just very creative ways to describe that someone is temporarily in a moment of time experiencing some sadness or some low mood. So holiday blues, winter blues are not medical terms. They are not disorders. You cannot code for them. You don't diagnose those things. And also, more importantly than that, they present differently. So the holiday blues, the winter blues, it presents with some low mood, some sadness, and it's very specific to a time period. It's specific to an event. So typically those things are specific to it being winter or Thanksgiving coming or Christmas coming and they're missing loved ones. So there's a specific reason that's driving these things that's based on an event or based on the calendar. Whereas seasonal affective disorder, as I said, it's a disorder and there's pathology, there's a mechanism behind what's causing it. And that mechanism is much more specific than Christmas is coming or Thanksgiving is here. The mechanism is typically due to the less amount of time we have sun exposure. We have the short days. The sun sets a lot earlier. And in doing so, that means we don't have the exposure to the sun that we typically would have during the spring and summer months. What this means in terms of our physiology is that the sun is not allowing or helping the brain to produce certain chemicals that we need to manage our moods. So the sun is important for producing vitamin D. The sun is important for helping us to produce our endorphins. Those are the feel-good chemicals that our brain makes, such as the dopamine, the serotonin, the norepinephrine. And also, the sun is important for melatonin and also for our clocks, our internal clocks. So, if you're not getting that sun exposure because the sun is setting so much earlier, the days are shorter. Sometimes, if you live in a part of the country where it's cold during the fall and the winter, you're not outside as much. So, therefore, you're not getting the sun exposure. And this is what happens as a result is that you're not having the hormones are not being made, you're sleeping differently, and then that creates pathology and disease, which is the disorder, the seasonal affective disorder.
That's interesting. As you talk about that, I go out in the mornings and just get sunlight in my eyes, to sort of set my circadian rhythm so that I sleep well at night. Whenever I'm having difficulty sleeping, I start doing that, and it really helps. So it's
Yeah.
interesting to hear how this ties in the sun and
Mhm.
your mood. And I'm sure difficulty sleeping is probably one of the symptoms of seasonal affective disorder. What are some of the other symptoms?
Whew, man. So it's very similar to major depressive disorder. So, we see a lot of sadness. We see that people actually oversleep. So, because they withdraw, they're no longer social, they oversleep, they overeat. Therefore, they gain weight because they're overeating and they're oversleeping. They're not being active. And so there's just a loss of interest in doing things. That's called anhedonia. They have low energy, they feel disconnected, they're not as social. Sometimes you might see some irritability. So it's very similar to major depressive disorder. With seasonal affective disorder, you don't necessarily see um, the suicidal ideations. If
Mhm.
that's happening, as I said, seasonal affective disorder is a type of major depressive disorder, but you would start calling it then major depressive disorder, severe. So seasonal affective disorder is the type of depressive disorder that pretty much a lot of people use interchangeably. When I say people, meaning clinicians and mental health professionals, will use interchangeably with major depressive disorder because they're coded very similarly. So the symptoms are the same as the symptoms of major depressive disorder.
And seasonal affective disorder is only in the winter. It's only well, in the fall and winter. Is there any summer version, or is there any depression that is associated with the opposite seasons?
Yeah, so there is this colleague of mine, actually at the University of Maryland in Baltimore, who conducted these studies on Africans as well as on African American students because there's this notion that seasonal affective disorder can also occur in the spring and the summer. It's very rare. It's not as nowhere as common as the winter, the fall and the winter seasonal affective disorder that we see. And the study that was conducted, it was on such a small population of students that it's really not significant. And so really, although it gets mentioned, seasonal affective disorder pretty much applies more so to the fall and the winter.
Okay. You mentioned, I think you said African students. How prevalent is SAD in the Black community? And are there any unique challenges in identifying it in this population?
So it's not any more unique than anyone else in the general population. African Americans, Africans, minorities experience seasonal affective disorder at the same rates as the general population. There's no difference. And as far as uniqueness, I would say the same factors that we see in other disorders with Blacks and African Americans and other minorities, such as schizophrenia and bipolar and generalized anxiety disorder, we don't get access to care, and also we don't understand at times our bodies, and we may not be educated by our clinicians and our medical team on recognizing certain things, and we may not receive the same instructions as the majority and how to take care of ourselves or how to recognize something or how to prevent certain ailments from occurring. So there's no uniqueness in terms of statistics. I think it's very similar to all the other mental health pathologies is that we're not accessing care, and also we're not getting the information so that we can make an informed decision or even recognize that we're experiencing something that's a mental health disorder.
Thank you, Dr. Delvena. We do need to take a quick commercial break. Black Health is brought to you by the Health Foundation of South Florida. Don't go anywhere. We will be right back talking more about seasonal affective disorder with Dr. Delvena Thomas.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
At DRT Behavioral Services, we provide culturally sensitive mental health evaluations with thorough treatment plans, incorporating alternative forms of wellness, not just Western traditional medicine. Besides medication management and psychotherapy, we provide education to people in the areas of minority mental health with classes on your diet's impact on mood and sleep hygiene for better rest. We also offer weight loss therapy, massages, and facials. Visit brainlovehelp.com today.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
Welcome back. You are watching Black Health, brought to you by the Health Foundation of South Florida. We're talking about seasonal affective disorder. Dr. Delvena, before we jump into diagnosis and definitely some treatment, just wanted to ask a quick question about melanin and Black skin. And since this is sunlight, does seasonal affective disorder affect Black people differently, or people with more melanin? Does melanin play a role in this at all?
No.
Okay, let's jump into diagnosis. How is it diagnosed?
Well, you have to experience the symptoms that I listed. There's several different manifestations of the disorder. I failed to mention lack of concentration or poor concentration, which is what we see in major depressive disorder as well. And sometimes people present with physical manifestations, which is why oftentimes patients who are experiencing a mental health issue will see their primary care doctor first, because they're noticing the physical stuff. And mental health is so stigmatized, they feel more comfortable, going to the PCP, reporting the headaches, the upset stomach, things like that. So, along with the sadness. And these things are continuous, it's consecutive, it's on several days. So at least 2 weeks or more. The seasonal affective disorder is occurring, as we mentioned, in the fall and the winter months. And typically it resolves as the days get longer. So as the winter is going away and the spring is coming and the sun is back out and, we're getting the rain and the flowers and the longer days, then people start to feel better.
So we are entering the holiday season, and I'm sure there's some folks watching that may suffer from seasonal affective disorder. Let's talk about treatment. What can be done? Is there hope? Is this something that can be treated?
Yes, there's a lot of hope.
Good.
And there's a lot of things available. So I'm holding up this device. This is a phototherapy device. This is available on Amazon, and I'm sure they probably sell it in places like Ross and Marshall's, on the little random shelf. Yeah. So you plug this in. This may not apply so much to people like you and me, Michelle, because we live in South Florida where we have sunlight. The days are shorter, but they're not as short as some other areas of the country. So doing things like phototherapy, if you know that you suffer from seasonal affective disorder, and you'll know this because you notice that every year you feel this way this time of the year. And I always encourage people to keep journals. You can keep a journal in your phone or on paper. And so it makes it easier to recognize certain patterns, which we may forget. We may think like, okay, I'll remember this next year, but you don't. And so doing things that are preventative, like the phototherapy, helps. Also, prevention is always key. So regular exercise, doing these things before the onset happens, regular exercise, maintaining a healthy diet, having a healthy circle of friends and family and supporters. Those are the preventative type things you can do. Once the disorder has you have the onset of the disorder and you have the symptoms, go and see a mental health professional. It may not mean that you have to receive prescribed medications, which sometimes that is a part of the treatment plan. Maybe just processing and talking it out with a mental health professional will be enough to manage the symptoms. But if it's not enough, that therapist or psychotherapist or even a psychiatrist who may be seeing you for therapy may say, hey, I think we need to add just like a small dose of an antidepressant to help you out a little bit. And sometimes if the person is oversleeping and they just have, low energy and they're not motivated, you might need to add something else other than an antidepressant to kind of pep them up and get them moving and make them feel a little bit more activated. So there's a lot of different things that we can do to prevent it as well as to treat it and control it when it starts happening.
So you showed us the light therapy box. How does that actually work? What do you do with it? How often do you use it? How long do you need to use it? What time of day do you need to use it? Are there specifics?
Yeah,
Specific
so it's electric. This one you plug in. Some are battery operated. When you plug it in, a light comes on. You look into the platform, and so this light helps to activate your brain. And as far as it's not, I don't believe this is an FDA approved modality. So there are not like specifics with in regard to how you use it. I recommend to patients that they use it in the morning, especially if it's someone who awakens at 4 or 5 o'clock in the morning, because that'll help get them activated and going, and then use it again in the afternoon. So in some places, the sun is already setting at about 4 p.m. or so. So if the sun is setting early, then maybe you should use this, and especially if you're still at work. So maybe you have one at home, you have one in your office, and so you can use this twice a day in the mornings to help kind of get you activated, as well as at the end of your workday when the sun has already set to kind of activate the brain more. I've seen a lot of different recommendations in terms of the length of time that you should use it. I've seen 5 minutes, I've seen 10 minutes. I would say not to use it longer than 10 or 15 minutes in one setting.
So I'm envisioning a bunch of people listening, running out or reaching out to Amazon for one of these light light therapy boxes, even if they don't have seasonal affective disorder, maybe to just pep them up a little bit in the morning or give them an extra boost. Does that work, or does this really only work for people with seasonal affective disorder?
No, it can help for other folks as well, because as you said, it's giving them that extra boost. There is something miraculous about light.
Yeah.
And when it's natural light, such as the sun, that's even better. I tell people all the time, we live in a place that's on the top 10 list of vacations. We live basically we're in the tropics, we're in the Caribbean. And so we should take advantage of our environment, get out and get sun. You don't have to go to the beach or lay out on the sand. You can go outside your home, sit on the porch, maybe create a small little garden in the front or the back of your house and spend time gardening. So that green therapy is also something that's helpful in being outside in the sun and receiving those rays. That's preventative as well as can be considered treatment.
It's just dawning on me. I'm that person that gets up in the morning and I open up all the the shades, the blinds. And in my car, I open up the sunroof as soon as I get in the car so that the light comes in. I need light. And when I used to live in St. Louis, I didn't have seasonal affective disorder, but I did notice that, at least I don't think so. I was a college student at that time, so I wasn't able to diagnose myself with anything. But I noticed, and I was coming from Florida. I was moving from Florida to St. Louis, and I did notice that in the winters, my mood would decrease a little bit. So it's interesting. I'm now putting together this wanting light and needing light and tying that into what I experienced when I was in St. Louis. So Dr. Delvena, we do need to take another quick commercial break. You are watching Black Health. We are talking about seasonal affective disorder as we move into this holiday season. So we'll be right back.
I grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family. Our future.
The difference we'll make for you, your loved ones, your kids matters because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
At DRT Behavioral Services, we provide culturally sensitive mental health evaluations with thorough treatment plans, incorporating alternative forms of wellness, not just Western traditional medicine. Besides medication management and psychotherapy, we provide education to people in the areas of minority mental health with classes on your diet's impact on mood and sleep hygiene for better rest. We also offer weight loss therapy, massages, and facials. Visit brainlovehelp.com today.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
Welcome back. You are watching Black Health, brought to you by the Health Foundation of South Florida. We're talking about seasonal affective disorder. So we were talking about the light therapy. Is there anybody that it is contraindicated in that should not use light therapy? Does light trigger any problem in any type of other mental illness, mental health condition, or other health conditions?
I have not read about or seen any absolute contraindications, but just thinking through some things, I would say maybe someone who's in the midst of a psychotic episode should not use light therapy. That's artificial light therapy, because maybe that could trigger some type of response from that person, or someone who's manic would not want to use light therapy, because when you're manic or hypomanic, you already have a heightened sense of energy. So you don't need that activation. And sometimes I would add another type of person, someone who suffers from seizures, because sometimes people will say, whether these are seizures or what we call pseudo seizures, maybe the light, for some people, it triggers a certain type of event for them. So if any of those three things are present or have ever been present, I would say not to use the artificial light.
Okay. How does SAD interact with other mental health conditions like anxiety or PTSD, bipolar, or does it not?
Yeah, that's a very good question, Michelle. If you suffer from other types of mental illnesses, such as bipolar, or some other type of depressive disorder, because there's many types, you are at higher risk of developing seasonal affective disorder if you're in an environment or in a part of the country that experiences these very short days and short exposure times to sunlight. So the interaction is that those other disorders or pathologies can increase the risk that one would develop seasonal affective disorder.
Are there any myths that you see, common myths around seasonal affective disorder? Or perhaps we address those with the holiday blues and the winter blues. Are there other myths that
Yeah,
around?
and that's what I wanted to say, is that I think probably the most common myth is that seasonal affective disorder is confused with the holiday blues. And so, we have to keep in mind that seasonal affective disorder is related to changes in daylight hours. So I just want to emphasize that it's more about changes in daylight hours, not the calendar. So holiday blues is more about the calendar. And so predictable types of things. So seasonal affective has nothing to do with the calendar. It's more so the daylight hour time.
Yeah, I think that's great advice. And I think that spans the different health fields, because I have patients coming in all the time, or parents, because as I'm a pediatrician, and, I'm not sure if she has an ear infection, and I'm not sure if she has a this, and I'm not sure if she has a that. Like, that's why you're here. You don't have to know. And I think patients and people do feel like they sort of have to figure it out before they go to the doctor, so they can, rationalize why they're here, and in case it ends up being absolutely nothing, which I think is sometimes people's fear, that I went for no good reason, and I look stupid or I look bad, which is never the case. We'd rather you come in and we make sure that everything is okay than you sit at home suffering, unsure. And sometimes it's better to just go in and hear everything is fine, and then you can put it to rest, and then everything becomes fine because you stop worrying about it.
Yeah. And what's wrong with going to the doctor? Even you don't have to visit your physician because there's something wrong.
Yeah.
Obviously, that's what drives most visits, but go and get your physical checkup. And the same applies to mental health professionals. Have a mental health professional on your medical team, someone that you go in and you just kind of do your checkups from the neck up. You go and see them, have a session, and you may not need to go back every week or even once a month, but at least that person is on your team so that when you're experiencing something, you have someone you can call.
We do need to start wrapping up the show. Can you give one final message of hope to those watching in terms of seasonal affective disorder, maybe expanded a little bit to holiday blues, as you know, people do get a little down during the holidays, especially if they've experienced something in the past that was traumatic or sad for them around the holiday season. So what words of hope and encouragement do you give as we go into this holiday season, whether you're suffering from seasonal affective disorder or you're suffering from sadness because of the holidays themselves?
You make the holiday what you want it to be. You are in more control than you think you are, and everything you need is inside of you. You have everything you need inside of you. And like I mentioned, build that support circle, that support network, so that you can do things like having a friend's giving, creating holiday parties. You can make things different. You don't have to suffer, and you don't have to suffer alone. We can join help groups. We can join support groups with people who may be experiencing the same types of things. So you don't have to accept what's going on in your life. You can do something about it. I think oftentimes people get stuck and they feel like there's nothing they can do. That is the farthest thing from the truth. That is the devil talking in your ear and telling you that you have no other options, because the devil doesn't want to see you doing well.
Absolutely. And Dr. Delvena can also help out. Dr. Delvena, how does somebody reach you if they want to schedule a session with you or see you for SAD, seasonal affective disorder, or for anything else?
Yep. Call our office at 305-981-1700. You can also.
Awesome. Thank you so much, Dr. Delvena. Always a pleasure to speak with you. Brain love.
Thanks for having me.
Always a pleasure to have you on the show, and you bring such amazing knowledge, and it's a gift to all of those watching. So thank you. Wishing you a wonderful holiday and a beautiful holiday season. And we'll see you, Dr. Delvena, I'm sure, again very soon on Black Health. And those of you that are watching, thank you for watching Black Health, brought to you by the Health Foundation of South Florida. We will see you next time. Happy holidays, everybody.